So if I were to talk about the top technology trends, without giving it a top 10 or top 5, whatever number, the top technology trends in healthcare, uh, I'll try to put the technology, the use case as well as the technology behind it, wherever possible. So right up there would be telehealth and remote care. Telehealth is the technology about using teleconference and connecting it seamlessly with the electronic medical records. Patient and the clinician is talking to each other in a very secure environment. At the same time, doctor is able to capture all the information onto the electronic medical record so that the care continuum is smooth. Remote care is about technology. The use case is brilliant because it helps you take care of a patient remotely, whether it is at home, whether it is in an ICU, whether it is in another hospital, and so on. But there again, the use cases or the technology used are the basic connectivities, the chips that capture the vital informations, which we call as popularly known as the Internet of Things, the IoT chips or the IoMT chips. The second trend that it's very popular is all around using artificial intelligence in healthcare. The AI in healthcare has being used in various places, but then one of the most popular ones, popular ones are around using AI on imaging. There were a lot of good use cases during the pandemic where the AI logic running on images were able to really predict a COVID case faster, or there were some of those case studies there. So yes, there is a lot of opportunity there, and on using artificial intelligence, running a logic on multiple images, so that the clinician then gets to see the most relevant one, so that it's good value of good use of time of the doctors. There is a lot of work happening around what we call as digital therapeutics. In simple language, digital therapeutics is about using a mobile app as a prescription. In other words, if I were to recommend as a doctor, say that why don't you download this app and use it and follow the instructions as the app says, and it will help you manage your lifestyle better, or it will help you manage your weight better, or your health better, or wherever. So there are various use cases of digital therapeutics, some very exciting ones in the market. So that's one of them. There is a lot of work around improving or getting the interoperability right. What do you mean by interoperability? You build a or a common exchange so that the patient data is available across health providers. So that a patient doesn't have to be bound with a particular health provider. He can move across health providers and still get the care continuum, because his patient data travels across health providers, and that is typically driven by health information exchanges. Like in Dubai, we have the NABID, which is the UAE, which is in Dubai, Malafi in Abu Dhabi, Riayati in Northern Emirates, and so on. And every other country is building their own health information exchange. And as health providers, we at Aster, we are also building our own health information exchange, so that the care continuum or the interoperability is established. And in the case of interoperability, you definitely have a master patient index, because it's just one identifier that tracks you across. There's another one that comes to mind is the use of virtual and augmented reality, the AR and the VR, or now a lot around Meta. And that's again one of the use cases which is very, very popular, is about how do you use these DICOM images and that come from your CT scans and X-rays, and how do I give it to a doctor in a virtual 3D model, so that he can see it and get good insights before he recommends a particular prescription to a patient, or prepares for a procedure or a surgery. Last but not the least, there's a lot of work again happening on around wellness. All of us in healthcare, in the health system nowadays, are working more on wellness than the conventional way of just looking at the sickness, because people would come to hospital when they are sick. And now there's a lot of effort working on how do I ensure my patient or people are well, citizens are taken care of, and they stay healthy, so they don't have to come to the hospital. So there's a lot of work happening around wellness, and that's again done through mobile apps and platforms, and linking that with wearables and various other gadgets that help the clinicians and help the providers keep the citizens healthy.